Hello and welcome. For this class you will need some rice bags, rice with socks knotted to make as like eye pillows and for your hands. Lovely hot water bottle is really good, and loads of bed pillows wrapped around in a hard towel or a bolster. Go on your bed if you can, or if you're struggling to do that, you can come onto the floor. So it's completely up to you, and we shall begin. Alright ladies, so if you haven't already, put your video on mute so you don't hear any background noise. I'm hoping that my household will be quiet this evening. It's quite loud last week, my household downstairs. where I do this every day, it kind of goes over my head. But yeah, so yeah, making sure you just mute because of any dogs or children or anything like that, cats. And then we're going to get the bolster out, and what we're going to do is we're going to come down into a child's pose, but we're going to thread one arm. We're going to leave one arm just behind us. We're going to come down so our head is on the bolster or the pillows and the towel, and then we're going to thread one arm in that gap, okay? So we just bring two arms to the side, and then with one arm thread it through the hole. So basically like that, and the bolster is here. Do you know what I mean? So we're just threading through. Come a bit closer. So threading through just like that. Okay. Okay, so just wriggling in, getting nice and comfortable. And bring your weight as much as you can into your bottom, and less on your forehead. So just mentally, with your mind, just making your bottom more heavier. Okay, and then when you're ready, you'll 3 deep big breaths. In through your nose and out through your mouth 3 times. So just start sinking into the pose, let go. For some of you it might feel comfortable, for some of you it might not. But the aim of the game is you have to rest in this pose as much as you can. However, you can use other blankets, pillows, other props to support you if necessary. But making sure that you're really nice and comfortable. That's all that restorative yoga is about, is getting in that comfy position. So while we're in this pose, I will let you know exactly what is going on in the body while we're doing this pose. Now, we don't really do this pose a lot in class. It might be quite new for some of you, The reason why we don't really do it in class is because of the knees. It can cause, you know, with the hard, if we have a hard floor, it can put a lot of pressure onto the knees, I suppose. But if you're on the bed, or if you're on a soft surface, then it's a very, it's more of a comfortable pose to do for some. For some of you, you might need to put pillows, cushions underneath your knees. If you're on the floor, and even in between the creases of the back of your knees. So have a play around. So we go from the top of the head, and as you can probably feel, where your head is on the bolster, it's really good to relieve some pressure of sinuses that are going on. So, you know, for me, like, I have a cold right now, and Laura's got a virus right now, and this really just opens up some of the sinuses in and around the nose and the eyes. So it just releases some pressure and it clears most of the fluid, and it calms down as well the inflammation. The inflamed tubes, because that's what sinus is. It's all about the nose and the eyes and the head being inflamed, and the throat as well. So we're just calming that all down in this pose. And also you could imagine it's really good for headaches, because again there's a little bit of pressure there that's happening, but our head is level with our heart in this pose. So it gives our head that nourishment that it needs, the blood, the air, and even water. The brain really loves to be soaked in water. It needs 70% of fluid, the brain, to feel nurtured. So doing poses like this is so good for the brain. And one of the main reasons though why we get into this pose is because of the shoulders. Especially if you have a trapped nerve. If you carry a lot of stress in the shoulders, a lot of nurses do. They carry a lot of stress on the shoulders, and sometimes, you know, definitely back in the day, we used to have to carry people. We used to have to lift them up, and it causes a lot of stress on our shoulders and our knees. So any carrying babies, carrying toddlers, carrying furniture, or anything that's very stressful as well, or give you anxiety. Sometimes our shoulders start to lift up near our ears. So this is a really good one to have, that shoulder stretch, and to open everything up and to release that stress. Release that stress energy that's going on, and it would just start to evaporate into the air. And going down to the neck, you can probably tell that this is very good for posture. Again, our body, our top of our body is being levelled out, and we're letting gravity do its work. And go down to the heart, and as we all know, very good for blood pressure. Restorative yoga is. It's very good for the heart, and it just calms the whole of the veins, the blood in the veins, the arteries, calms it all down, and they're all working evenly as well. That's a very important thing, as you can imagine. This pose doesn't really do anything for the lungs, so we go down to the stomach, and as you can imagine, the stomach right now is being squashed. So this is a really good detox, because it's pushing all of the toxins away, you know, in the intestine, everything that's in there, the kidney, the liver. They've all got their separate jobs. They all live in separate places in the tummy area, but they're all being squashed. So we're squeezing the toxins out, and then when we come up from this pose, everything's been released out and it's moving down our body. The lower back as well, the lower back, this pose just creates a lot of space for the lower back, and if you just feel the lower back right now, you might be able to feel your back, as we say, breathe. You might be able to feel it breathe, meaning it might feel a bit spacious. It might feel as if it's had a bit of a massage. And in the hips, this is a really good pose for the hips. It's a hip opener, and gravity is also doing its work with the hips, keeping the hips down and open. So this is very good for people with sciatic nerves, trapped sciatic nerves. Okay, so just gently taking that arm out and placing it behind your body, so the hand is touching your foot, and then we're going to go with the other arm. So bringing the other arm into the tunnel. And while you're here and we're in this pose, I just want you to focus on what I just said, and just picture your body doing these things. And if there's any thoughts that come to mind about anything else, work or dinner or some drama or EastEnders or something like that, then just leave it to one side of the mind and bringing your attention back to the body, back to how it feels, back to what it's doing. Okay, so we gently just start to bring our arm back to the other side, and then we're going to bring our hands just across from our ears, so hands, just so you can roll over to one side into a fetal position. And then gently just pushing the bolster off the bed, off to the side, wherever you are. And then we're going to lay down on our back and bring our feet down onto the bed, so we are just laying straight. Just do 3 deep big breaths while you're here. And what we're going to do is we're going to stretch the sides of our body, and we're going to be like a half moon. So we're going to bring our hands to one side of our body as far as they can possibly go, and then we're going to bring our feet to the side of our body as well. So we're going to try and touch our hands and our feet in a half moon shape on the bed there. So making sure that you're comfortable as well, so you don't have to actually do the whole half moon. You have to feel comfortable, but just image, if it's too much, then just do a little bit. We're just finding that stretch in at the side of our back. There'll also be a little stretch around the neck and the outer thigh as well. But being in this pose, it's really good for the kidneys, as you could imagine. You might be able to feel, I mean I can, but then again I've got lupus, so I can feel my kidneys, but some of you might be able to feel your kidney being squashed a little bit, and if you can, that's a good sign. Because when they're squashed, you know, it's like a sponge, we're squeezing out the toxins, we're helping the kidneys. So that's really, really good. And depending what side you're on as well, we go the other side in a minute, but it's also really good for the liver, the pancreas, the gallbladder, the appendix if you have any. Some of you might not even have a gallbladder, I don't know. But everything around the sides of your body is being squashed. Also, this is really good for posture. If you imagine the spine right now, it's having a bit of a curve, a bit of a tiny little C shape, but just a stretched out C shape probably, because we're not fully into a C shape. And if you can, with your feet, you can bring your feet closer, so you can move your legs closer to your hands, and that will just give you a more of a deeper stretch. For some of you, it might feel very uncomfortable, and if it does, then just do your limit. Listen to your body. But some of you might be able to touch your toes with your feet, and if you can, then wow, that's amazing. Some of you are flexible. And it's just no shock. I know someone who has a walking stick who is very, very flexible, can touch her feet and everything. So yoga's for everyone, it really is. So just feeling that side, the side stretch, the stretchy bit that's going on the outside. Not forgetting this bit. And then really slowly start to squirm your feet central with your body. Okay, so we're trying to go straight again, but you have to be really careful. So just wriggling your feet to the centre of your body, keeping your hands where they are. And then just really, really, really slowly, as slow as you can, coming central with your head, your neck, and then bringing your hands down to the side of your body. Just closing your eyes and just feeling one side of the body to the other side. Just noticing if there's anything different that's going on. Is it different to the other side? One side might feel squashed and the other side might feel stretched. And how bizarre is that? That's what I love about restorative yoga. We're in poses where you wouldn't even imagine doing in everyday life, like the pose that we just did. But we should be doing it. Okay, so now we're going to go the other side. So moving the feet first, the legs, the feet, and then lifting your hands up, overhead. And again, just mentally imagine that you're in a C shape or a half moon shape. Just imagine how many muscles are working really hard right now for the spine. This is what our muscles are supposed to do. They're meant to support our bones. And if we just sit there and do nothing, then our muscles, I think when we get to a certain age, I think it's 35, I could be wrong, but I think it's 35. We get to a certain age and we start losing muscle mass quite dramatically if we don't exercise. And obviously that can either be walking or swimming, anything. But if we don't do some form of exercise, we start to lose all this muscle, and that's where things go wrong with the body. There's a lot of passive stretching that's going on for the spine right now. And some of you, some of you are quite flexible. You'll be able to feel the muscles in your neck as well. And if you deeply feel, you can feel the muscles from your neck all the way up from your skull that are being passively stretched. Places where no one else can touch. And that's what's very magical. So you might want to give it a go, see if your feet can go any further to your hands. Remembering that just because one side of your body could do it or couldn't do it doesn't mean the other side can't or can. So gently start to wiggle the toes, wiggle the fingers, but shuffling very tiny shuffles your feet to central part of your body. And then just hang out here a minute, making sure that the muscles know what we're doing so they don't get confused. And then wiggling the hands, the fingers, and really slowly, as slow as you can, bringing them to the side of your body. Again, so you're in a neutral position. We're just staying here a minute. Again, just feeling the body, feeling what sides have been stretched, if the body feels any different. Staying in that present moment with the body in the mind. Just going to close my window so it's cold. And we're just going to roll over into a fetal position. And then gently rolling yourself up from the bed or the floor, making sure your head is last to get up. So what we're going to do for our next pose is we're going to come onto our belly. So if you're on a bed, this is absolutely perfect. If you are on the floor, if it gets too uncomfortable for your belly, or low for your hips, then I want you to come onto your back and bring your leg out to the side. Okay, if it's too uncomfortable, what we're going to do next, this is the second pose to get into, the alternative pose. Okay, so what we're going to do is we're going to be laying on our belly, and we're not going to have any pillow. It's just going to be the bed or the ground, wherever you're on. We're going to lay down, and our leg is going to go out to the side, so it's bent and it's out to the side. And we're going to bring our hands behind us, and then our head is going to go the other direction to the leg that is bent. So it's going to go the other direction. Okay, so leg, and triangle it as high as you can if possible. Okay, the leg. Bringing the arms, the hands down behind you, and then turning the head the other direction. And obviously, if that's too uncomfortable, come on your back. Do the same pose, but on your back. And you might want to prop your legs up with some pillows if you're on your back, if you have hip problems. Play along with it, and then make sure that you're nice and comfortable. Okay, so just, my head at the moment is the same side as my leg, but it's because I'm talking to the camera. So making sure that your head's the other direction to your leg that is bent outwards. And when you're ready, 3 deep big breaths in through the nose and out through the mouth 3 times. Real deep. Just chilling, just resting, melting onto the bed, letting gravity support you. A lot going on here right now, as you can imagine. Our cervical spine, our cervical vertebrae, our neck, whatever you like to call it, is being twisted in one position. The thorax and the lumbar is being twisted the other position. So it's as if in a tiny little way that the spine is being rinsed out like a cloth. It's kind of the same kind of move the spine is doing, but obviously very gently, not as rapid, not as bad as, you know, wringing out a cloth, but it's just getting a gist of what's happening in the spine. And then of course we've got the hip. The hip is being opened, just one side of the hip. So all the muscles around the bones are thinking, hey, okay, we're passive stretching even more to protect the bones. Really, really good for people who suffer with back pain. For people who suffer with arthritis, this is such a good pose. And even with people with fibromyalgia as well. And emotionally, it can feel very supportive, very nurturing, taking you back to a child, you know, with your mum or your carer. Maybe you didn't have a mum at a young age or at an older age, but with your dad or your nan, and when they used to hug you and your face used to be on their chest,
it kind of feels like that. It kind of feels like a really nice hug that's going on. So for me, is when I was a little girl, I used to sit on my nanny Daph's lap, and she always used to squeeze me into her chest, and it felt very lovely and caring and safe. And it's the same for many people with their adolescents, their carers or parents, nans, granddads. So obviously the endorphins start to arise in the body, and the oxytocin as well, that's the word, the hug and love hormone. But with the endorphins, when they come into play in the body, they actually relieve pain in the body. That's what endorphins do very well, is they can dumb down the pain, nerve pain. That's why a lot of doctors, if you do have a lot of pain, they give you antidepressants, and it's because they want the endorphins to go at a high maximum level to sort the pain out. And if you're dribbling, don't worry, we're at home. No one can see us. Just having a good feel now. I'm going to be quiet for a little bit. Having a good feel. What feels nice for you in this pose? Whatever feels nice, just hang out with that feeling. Don't think about anything else. Let that leave your mind and bring your awareness back to this nice feeling. Okay, so wriggle your fingers, wriggle your toes. Real slowly bringing your head into neutral, central position, and obviously without suffocating yourself. And bringing your arms and your hands bent up, so your hands are near your face. This is just to support your neck and your head. And then bringing the leg down that is bent, bring it down very slowly. And then when you're ready, in a slow manner, roll over to the side in a fetal position. You can never go wrong with rolling. It's just very safe. Fetal position after is the safest. Just staying here for the moment. We're going to roll back onto our backs. So back on the back. And then of course we're going to go the other way now. This is the most safest way to do it. So we're going to roll over back onto our belly. And then we will do the same but on the other side, so the other leg. And then bringing our arms down and our head the opposite direction to our knee. Wriggling in, making sure that you're straight, as straight as you can be. You might find as well that your shoulders are a bit far up near your jaw, and if so, then mentally just relaxing them down, not physically but mentally, so they will just melt throughout the pose. And then when you're ready, you're free. Deep big breaths in through your nose and out through your mouth 3 times. Okay, then just wiggling your fingers, wiggling your toes, bringing your head to neutral,
placing your hands very close to your head, elbows bent, just to protect you so you don't suffocate. And then bring your leg down into a neutral position. And when you're ready, roll over into a fetal position. Now you can either stay here or you can come onto your back for the last part. Actually, stay in your fetal position, and I want you to look and stare at your candle if you have one. If you haven't, that's fine. So just lighting your candle. And for some of you, this is a video, so you can pause this and get yourself a candle. For some of you, you might not have one, but if you have, please just stare at the candle in a fetal position. You can either turn the lights off or you can leave them on, it's up to you. Maybe you're too rested, too relaxed to get up at the moment. But you're just going to stare at your candle, and this is actually a meditation, a candle meditation. And you just really gently close your eyes, but just enough that's open for you to gaze at the candle. So with soft eyelids, so your eyes are open but your eyes are open but your eyelids are very soft. So you can almost see your eyelashes. So just your eyes are open a little bit. And you're just watching the flame. It might move side to side. It might flicker. But whatever comes into your mind, just let it float by. Any noises, anything that comes to your mind, let it float by and bring your concentration back onto the flame. Your flame might start to dance. And if you can, try to find a connection with the flame. You might feel as if the flame loves you, and if you do, then go with it. Love is the answer. Some of you might just see a flame that's not moving, and that's still okay. We go where we need to in life. We all have different experiences, and we still get there in the end. Seeing what colours they are. There might be yellow, blue, orange. We're just staying with this for a tiny bit. And when you're ready, gently wiggling your fingers, wiggling your toes, come up to the camera. Thank you so much for joining. Much love. Take care, and let me know in the comments how you got on with your class.